Thank you for joining us for our short webinar about how Bolton have developed a better digital offer. This webinar will explain to you the journey that we've been on, what went wrong, what we did to remedy it, and the outcome of taking that action. My name is Cheryl Wyatt and I'm the manager of the Bolton Information and Advisory Service for SEND.
My name is Nan Cooper. I'm an IAS caseworker here in Bolton and I'm also chair of the Parent Carer Forum. What we're about to talk to you about, we hope will really help you in enhancing your own digital offer and getting better engagement from families. However, we know that as this webinar runs, you may be thinking to yourself, how on earth will we be able to find time, staff and resources to do all that? Well, here in Bolton, IAS and the Parent Carer Forum work together to ensure that families in our locality have the best offer possible. For workshops, this means pooling our resources. It means that we can give consistent messaging and we co-produce all the materials we use. And importantly, this means that IAS can meet their minimum standards without neglecting spending time doing that core work with families. This is a model we've used for many years now, and it's hugely beneficial to the IAS service, the forum, but importantly to the families. We would strongly encourage other IASs to have conversations with their local forum about how having that shared vision and outcome can help you in your area.
Previously, our workshops were all face-to-face. We ran daytime and evening sessions most weeks with a full house each and every time. We hardly ever needed to publicise them, as parents, carers and professionals would be waiting for new booking links. They were that popular. We'd have sometimes between 15 and 30 attending each session. The sessions were always very structured, with a first half, a break and a second half. There'd always be an activity over the break period where attendees would need to link up with each other to work towards a solution. We made a point of having really nice refreshments and snacks so that attendees felt looked after and that they were wanted and valued here. And this in turn promoted an environment for really good discussion, with parents being comfortable to ask questions and leave feeling like it was time well spent. Our feedback that we collect after every session showed attendees' knowledge and learning had increased significantly through coming to the session, that they felt that they had tools to make change and that they'd enjoyed the session itself. We know that some even went on to make new friends via the session. So a byproduct of attending the workshop was that some more isolated and maybe new to SEND parents found their tribe and got some peer support. We always made sure that we had 2 spaces earmarked for professionals to attend, and these were always filled. Our workshops have been attended by assistant directors, head teachers, SENCOs, allied health professionals, designated clinical officer, and many more in between. Our sessions have been highlighted across the local authority as something of real quality and are really well regarded. However, then COVID hit, as we all know.
When COVID hit, we had a lot of decisions to make about our IAS offer generally, and also the workshops and the viability of doing them. Cheryl decided that IAS would carry on supporting families throughout, as we always had done, aside from no physical face-to-face work. We anticipated by following the news closely that lockdown was imminent, and so around a week before the announcement was made, we'd already hedged our bets and moved to home working, and we were fully set up on a remote system. So although COVID still changed the way we worked, we were prepared for it and already in the planning phase of how workshops would run. We decided to still offer them, but online via Zoom. Everybody else was doing it. We kept the attendance number the same. We kept the format the same. So basically everybody could speak and ask questions, and we kept the timings the same. And really we just took out the activities. We very quickly had to have a rethink after the first couple of sessions and change the everyone available to speak function to make controlling the room easier. We were really quite new to delivering webinars though, and our inexperience in this clearly showed, as you will see. So it was new territory for us. We'd never had anything to say negative about our workshops before. Uptake and attendance had always just been taken for granted. It just happened organically. But here we are with a workshop offer that no one really wanted. And quite frankly, we were actually even dreading delivering. We'd always been known as a bit of a double act when doing our face-to-face working. We'd bring some humour, we'd bring personal experience about our own children into the session. And we were at a stage with our online offer now where that passion didn't just come through at all, and we were actually boring ourselves.
So Nan and I thought about all the Zoom meetings that we'd had to attend recently. I guess the things that we were all doing at that time, sort of training sessions, webinars, etc. And we realised that all we'd done for the past few months is moan about how bored we were and how non-engaging those sessions were and how we were sick of that format. And we realised that we were becoming the same old. And that's not how we work here in Bolton. So we went on to develop and redevelop our current offer. So we went back to the drawing board and started our big redesign.
We looked at all the things that we know our families love about our face-to-face workshops and what we really loved about them as well. We then noted all the things that didn't work in the current offer, and we made a plan based on all of these factors. What we established was we needed a hybrid approach. So we redesigned the whole thing, from the point of booking to the following up afterwards. We started by looking at how we took the bookings. We used to send an automated email confirming arrangements, and instead we decided to go for a mass text approach, as text seemed to be something that people engage with a bit better than generic emails. So we approached the local authority and we were able to get some funding to purchase a bolt onto our database that allowed us to send texts en masse, not too dissimilar from what you get when you have an appointment coming up from the doctors. People who booked on then also got a follow-up phone call from one of our volunteers, who also then arranged to drop off a pack on the doorstep.
So the packs included the activity with instructions, the service leaflets, the accompanying workshop guide to help you follow along or make a note of any questions that you might have, notepad and pen, some sweet treats, biscuits, a travel mug, which is what we had some surplus left over from a previous COVID grant that we'd had previously, some sachets of hot drinks, and some promotional bits and pieces, so a keyring or a trolley pound, all boxed up nicely, ready for the family to receive.
And then a week before the sessions, the doorstep visits took place. Also, these were done by our volunteers. They were used to do the introductions around the service, outline what would happen on the day and explain what was in the packs and what they'll be used for, and talk through the guidance notes. It was though we used this as our little welcome that we'd normally do when people arrived face-to-face at our workshops. Through doing this, we actually found that attendance went back up to 100%.
And when it came to the sessions themselves, we only admitted 6 attendees at a time. And because of doing that, we were able to have a nice cosy group where everyone could talk and have space to share their own experiences. This also allowed us time to do the same, so we created that connection and created a safe environment. People had their cameras on and we kept everybody's mics on so they could chip in and comment and question things as we went along. With a smaller group, this was much easier to control than it was when we did it with the bigger groups. And we found that because the expectations about cameras and mics and being in a distraction-free environment were communicated really clearly beforehand, people had time to plan for this. And so we had families who were all very much engaged in the session with little background noise or people disappearing to sort things out. We maintained the breaks so that people could check on children or grab a fresh brew and have a toilet stop, etc.
And we'd also reintroduced the activities. So everybody had their own copy at home, and our activities in our face-to-face sessions are kind of sort of sorting activities where you'd have lots of things to sort into different categories. And by everybody having their own version at home, they were able to do the activity, and then we used the voting function on Zoom for them to be able to submit their answers. So this not only helped cement the learning, but it was also an opportunity to keep the session on task, and it kept the attendees on task as well. So they actually had to be sort of participating at that point, and they knew that we'd know that they were with us or not as well. So by doing this and being able to chat about the answers and have some discussion as well, we basically regained our usual chatty, light-hearted, friendly sessions.
And whilst we couldn't hang around at the end to chat to families after the session like we would normally do in a face-to-face offer, We offered them 2 options instead. So a follow-up drop-in the week after, which was virtually on a one-to-one, or access to a dedicated email address where they could ask any queries that had arisen as a result of the session, and they would get a response within 24 hours. And both of those options were utilised by attendees.
The major motivator we found was the doorstep visits with the packs. These were really well received from families, and several told us it was the only real contact they'd had in some time. It was obviously all well risk assessed and done in a very COVID secure way. So we now had an online model that was really working. So we've got better turnout. In the original sessions that we did, we were lucky if we got 50% of the people who booked turning up. We had engagement. So we knew that those people with us were actually with us and enjoying the session, that they weren't ironing in the background or on the phone or something like that. It was interesting for us as hosts. And that's really important as well. You have to enjoy doing what you're actually doing. And just reading from PowerPoints, people we found was really sort of draining and not particularly interesting for us, but really engaging with people is what we found interesting. Parents felt welcome. So it wasn't just drop in for a casual session. It was actually a session where you were actually engaged with your little group. And we were getting better feedback as well from the people that attended.
So what did we actually need to make our online offer better? So we had the addition of the lamplight bolt-on, so our database bolt-on, to allow us to do the mass texting. We needed volunteer time for doing all those communications and conducting those doorstep visits. We needed some time to put the packs together. We invested in some backgrounds for better visual delivery on screen. We invested in some lights and microphones, which were particularly useful in those evening home workshops. And there was the initial outlay for the goodies in the packs as well. So granted, this all looks very costly and time consuming, but that's genuinely not been the case. So in a daytime session, which we would run for 2.5 hours with setting up, packing away and travel time additional to, it equates to an IAS officer being away from IAS work for almost 2/3 of their working day. Whereas doing it online, it's no more than 3 hours all in. In the evening, after a full day of work, it's really tiring for staff to then go on to do another few hours of presenting whilst juggling their own responsibilities at home. So in some cases, Nan and I have done a 13-hour day if it's been pointless nipping home in between and we've had to stay on. So doing them online has meant that we can finish work, sort out what we need to sort out at home, eat, rest, then be refreshed to go and do the workshops, finishing on time and in the comfort of our own homes. Cost-wise, we've saved quite a bit on not having to pay for things like 10 cents parking, paying expenses, paying mileage. In fact, when we did the numbers, we found that we were working out 75% cheaper doing them online than we were face-to-face. So this money then goes directly into the outlay for the items that we needed for the packs, and there was still some left over. So we're actually in a better position time-wise and money-wise, and have bettered our work-home life balance and staff wellbeing. We did ask the local authority to help by way of a very small grant for the text that we needed, that we alluded to earlier, so that's the bolt-on for the database. This came under a COVID funding pot that Bolton Council had available to them at the time. So we would need to find a way to make that sustainable moving forwards, but that amount was nominal, so that's more than doable for us. Some families of very complex children and single parent families have struggled previously to attend our face-to-face sessions due to childcare issues, and neither a daytime or an evening has fit them before. And this was particularly pertinent with the families with the very sick children that have continuing care needs. So having an online offer where they can just jump on at home with the kids in bed or being looked after in their own home means that we're now reaching a whole demographic that we weren't able to before at all.
So although the numbers are slightly smaller now, we've actually gone from roughly a 50% attendance to 100% attendance. So in those first 4 sessions we did of our original offer, we had 15 places on each, but people just weren't turning up, and we don't really know if they were engaging totally. In our new online offer, we'd have 6 places on each session. So we had 24 people in total, but we had 24 people turn up and engage in the full session. And importantly, we've maintained this as we've gone along as well. So it's a far more valuable session that we're actually running. And what have our attendees said about it as well? So we've always asked for feedback whenever we've done workshops, and we carried on obviously with these ones. So these are a couple of the feedbacks that we got from parents. The session was great, really well planned and very informative. I felt comfortable asking questions and managed to get all the information I need now to make the right decision for my little girl. Having the guide they bring round beforehand is very useful as a reference tool if I forget anything. And that's an important thing that. So we always have a little handout at our face-to-face workshops. And in those first ones that we did, we sort of just didn't include those because we didn't think it was necessary as much. But we were able to send those out in the pack so that they actually had them, and it stops people having to need to make notes, or we can always say you've got all those things noted for you for later. So they were something that we already had, and people found very useful. The workshop was brilliant. I was worried that it would just be lots of being talked at, but the way it was run was really interactive, and I had lots of time to explain my own situation and what advice I was looking for without feeling rushed. Having the home visit was lovely. It was nice to see a face.
So despite relaxation of social distancing rules now, we're definitely going to keep an online offer running alongside our face-to-face offer. There are just too many pros to our families and to us to discontinue doing that completely. And now we've got a model that works and works really well. It allows us to reach families we didn't before, as well as make savings in both time and money. So we're definitely going to build this into our offer as a permanent thing, whilst continuing to refine and evolve it further. So currently, we have our workshop offer set up for 6 topics usually that run throughout the year, and the online one is currently only set up for 2, but we're in a really good position now where we can evolve and develop that to further extend this offer and continue with our hybrid approach moving forward.
We hope that this has given you some food for thought about how you can better your own digital offer, and we wish you every success for doing so. Thank you for listening.
Thank you.